Our Total Joint Replacement Center here at the Everett Clinic allows us to cover every aspect of the body, and with patients who have arthritis and are in need of a joint resurfacing or a joint replacement, we can provide that in all aspects. Arthritis in and of itself is not a disease, it's a condition. It's a mechanical wear and tear on your joints. So the way we treat it without surgery is involved with treating the symptoms themselves, meaning the pain and inflammation that's in your joint. Patients might decide to move forward with a joint replacement procedure when they've tried a lot of the non-surgical ways we try and treat the pain, whether that's medications, injections, or physical therapy. Ultimately, when those measures no longer help their pain sufficiently and they're still having significant pain limiting their activities, that's usually when patients opt for a joint replacement. Our joint replacement team here at the Everett Clinic is outstanding. We have years of experience. We use a combination of traditional, well thought out, successful joint replacement procedures and combine that with new and emerging technologies such as robotics, computer navigation, and others to accelerate your recovery.
So in preparing for a total joint replacement, this is a major surgery, and so we want to ensure that medically you are prepared for surgery. This includes getting labs, an EKG, sometimes seeing a cardiologist if you need to. We also want to make sure that you have an adequate caregiver at home for the first week or so after surgery, somebody that can stay with you and be with you as you're recovering from this major surgery.
Here at the Everett Clinic, we are trying to do our best to educate our patients so that they're more prepared, all with the hopes that we can get you to the point where you're very comfortable going into surgery, that you know what to expect and have a better outcome because of that.
We recommend a total hip replacement when patients have end-stage arthritis and they've failed conservative measures. The pain bothers them more days than not, and they're ready to do something surgically. A hip replacement involves making an incision on the outside of the hip. We then take down the hip capsule, and the part that we replace is just the diseased articulating portion. We then use a acetabular reamer, kind of like a cheese grater, to recreate the socket of the acetabulum. We place a titanium cup with a plastic liner. We then prepare the femur with a titanium stem and a ceramic ball on top. Articulate these together, and that gives you a friction-free surface to move your hip around on.
When a knee has reached bone-on-bone changes, whether that's in one part of the knee or the entire knee itself, a knee replacement is considered. That can be either a total knee replacement or a partial knee replacement. The principles are the same. We make cuts on the ends of each bone, starting with the femur bone, not a lot of bone, about 7 to 10 millimeters all the way throughout, and replace that with metal. We do the same on the tibia side, the shin bone side, and in between those two pieces of metal goes a plastic liner, and that liner is your new cartilage. With a partial knee replacement, we do the exact same procedure, but only involving the part of the knee where the arthritis is entailed. These tend to be more natural feeling knees, and they feel more like your knee because most of it is your knee. After a hip or a knee replacement, most patients either go home same day or are out of the hospital the next day. I follow them pretty closely afterwards, every few weeks or so, and they're usually seeing physical therapy 2 to 3 times a week after that. So someone's making sure they're progressing their exercises and progressing as expected. If you have been dealing with a painful knee or hip for several years and want more answers, we'd love to see you in person. I really encourage you to come see us, where we have a really specialized team of physicians and physician assistants, as well as nurses, who are dedicated and spending the time with you to figure out exactly what's going on and what options you might have to treat your pain.
The Everett Clinic Joint Replacement Program's priority is your safety and care. We recognize that having a surgery like this can be stressful, not just for yourself, but even your family. And we hope to help you navigate through that process as easily as possible.